This minute is dedicated to a method of administration innovation. This is the Bolee Bag and the large cap Bolink, and this connects together directly to the patient's feeding tube to administer tube feeding. It's designed for gastric feeds. So I've set some formula up here in the Bolee Bag. This is a thicker formula I put in here, a commercially prepared blend. You can use standard formula, you can use a home blend, but you put your formula in here and then directly connect to the feeding tube. It's an end-fit connection, so it's a nice secure connection. And then the formula can either hang to gravity and flow through, or you can squeeze the bag and help it along. If you have a thicker formula, sometimes you need to squeeze it, or you can actually roll it like toothpaste container to squeeze out the formula and allow it to flow through your gastric tube. So I get asked the question a lot is how fast should gastric feeds take, whether it's a blend or a standard formula. I really recommend stretching it out over the course of 20 minutes or so. Minimum is my preference. I don't think that power feeding is a good idea. You really want to simulate how long would it normally take you to consume that amount of food or formula. So a good 20-minute minimum is a great marker, sometimes 30, sometimes patients need a little bit longer, it just depends, and they can sort of determine their tolerance that way. Lastly, I just want to say that from an insurance perspective, this is coded as gravity, and it can simulate either bolus feeding or gravity feeding from a clinical perspective, but from a billing perspective, it's coded as gravity, and that is what insurance will look at, and it does not require any special justification for Medicare. So that's another fun fact. So this is your introduction to the Bolee Bag method of administration.